So I get this question a lot, and this is totally a YMMV question. So your mileage may vary kind of question. The question is, why are you so cautious about benzodiazepines? So, benzodiazepines are a class of medicines that we use that hit a certain type of receptor in your brain to help you calm down and to not feel so anxious. And they are super good at what they do. In fact, they are so good at what they do, they cause a whole bunch of problems if you're not careful. So, here's a caveat. So, let me put the asterisk in the air. These medications are safe. They are approved by the FDA. If you are using these medications, please do not stop them without talking to your licensed medical professional because some hiccups and things can happen. So don't stop your medicine. This is all about giving you some additional information. So benzodiazepines are very, very safe. We use them a lot of times in anxiety, for panic attacks. It's also a seizure medicine because of the way that it works. It can literally prevent and or stop seizures. So all of these things are this class of medicine, very, very helpful. Here's where the hiccup happens is because they work so well, because they work especially when it comes to anxiety, they can create two different types of dependence. So the first is the physiological dependence, which is where you need more and more and more of that medicine in order for it to work. We call that a tolerance. And then the other hiccup is if you take it away, you go through withdrawal. So you get really shaky and sweaty and you start to feel bad and other things can happen. And so that's a physiological dependence. And then there's the psychological dependence where you feel like you need them. So in other words, if you don't have them, you start to go, oh my God, what's going to happen? And then you start to freak out and it makes things worse. And so benzodiazepines, if you're not careful and you're not paying attention to how much you're using, how often you're using them, sometimes that can create an issue. And so, and we never, as psychiatrists, we never want to create a problem from the things that we're doing to help people feel better. That is not our goal. So I'm sure y'all have heard about the opiate crisis. And so a lot of primary care doctors were like, oh, we need to treat pain and I don't want you to be in pain and here's some pain medicine. And then had all these, the immediate effect is, yay, it treats pain. But then for some folks who are using too much, it starts to give you a sense of euphoria and feeling good. And then it can create a cycle of behavior that is not helpful and again, has led to the opiate epidemic. And so we never want to get that. We don't want to go down that particular pathway for benzodiazepines. And so we are when I say we, let me speak for me. I'm very cautious about using those medicines. And if I do use those medicines, I make sure to give you all of we call it informed consent. It's all of the risks, the benefits, the side effects. If you use it, if you don't use it, I give you all of that information before we start them. And then I'm always going to make sure I explain when you're coming off of them. And for most folks, it is a short course, somewhere between 2 weeks to a couple of months. Try not to do it longer than that, but depending on the situation, I might, and your treating clinician might. So for some folks, you may be on them for years or not. It just kind of depends. So, but that's why I'm super cautious about benzodiazepines. And then there's one benzodiazepine in particular that I hate with the heat of 1,000 suns, and I wish they would take it off the market, and that's Xanax. And so if you're on Xanax, I hate it. Hate it. That'll be a whole other topic for a whole other day. But yeah, so to recap about benzodiazepines, they are very safe medicines when used appropriately and under the guidance of a licensed professional. And so don't stop those. If your licensed professional is very cautious about using them, I hope that my explanation helps to shed some light on it so that if your doctor is like, hey, I really, really need you to come off of this stuff, that's why. So it's not because we want you to be uncomfortable. It's because the risk benefit profile changes over time. Okay.